Sometimes leaving a hospital setting can be scary. You've just been treated for something, maybe you've delivered a baby, and once you're home, reality sets in. But Licking Memorial, Health Systems doesn't want you to feel alone. So here to tell us about their home visit programs, we have Rob Montagnes and Heather Burkhart. Thank you both for being with me.
Good morning, Robin. Happy holidays.
Happy holidays. We are coming right on it.
Yes.
It came quick. So let's talk about some of the things that you guys do. I know, Rob, we always talk about Licking Memorial Health Systems. Really, the mission is improving the health of the whole community, not just those maybe that are in your care at that moment. So how do they help patients after they leave their care?
Sure. I think, in today's population health management environment, certainly the traditional home health care is still out there, and we provide that. But you're seeing a lot of additional services that maybe you wouldn't have traditionally seen done in the outpatient or home setting. So, the physical therapy, that's been done, but we continue to see a lot in that realm. Managing medications, helping folks, especially if they have multiple prescriptions, and managing that.
Right.
Other types of therapies. And I think what we've really hit on, and I'm sure other health systems are doing this as well, is certain patients with specific diagnosis. So a COPD patient that maybe has a high risk to be readmitted or to have some challenges clinically, or someone who's obviously healthy but maybe a new experience like having a baby. So a mother-baby well visit at home to make sure things are going as they're supposed to. So I think we're branching out more into other areas that maybe are more preventative to try and keep them from coming back to the hospital.
Right, and that's the thing, is people don't necessarily want to come back to the hospital, right? They want to be home, they want to be comfortable in their own surroundings, and this is just a way you're helping them to do that.
Yeah, I think the proactive, preventive approach is what you continue to see, and it expands more and more, I think, really every month.
Okay. Heather, we are going to address COPD care first, for what that is. First of all, explain it and why that home visit is so important for patients with that.
Sure. So COPD stands for chronic obstructive pulmonary disease, which is a progressive lung disease. So while there's no cure for COPD, we can certainly treat symptoms that the patient may experience. So the importance of the home visit is really to get a registered nurse and a respiratory therapist out into the home of the patient and provide ongoing education related to the disease process first and foremost, so that they have an understanding of what's going on with their body, but also the signs and symptoms to look for. And also another important aspect is making sure that they're taking their medications appropriately as well. So,
okay.
and hopefully they'd be able to realize early on what those triggers are, or their symptoms are, and seek early medical intervention, and avoid ED visits and potential hospitalizations too.
Right, that is the goal, right?
Right, absolutely.
Exactly. All right, so the benefit too, as Rob mentioned, a mother-baby home visit. What exactly does that look like, first of all, and what does that do to benefit that family?
Sure. So you talked about right when we opened up that it becomes kind of scary when you go home after being in the hospital, especially when you're now responsible for this new life.
Oh, yeah.
It can be overwhelming sometimes. So our nurse visit, she performs a thorough assessment of the newborn to assure that the baby's growing as it should, developing as it should, which provides a lot of reassurance to the parents that they're doing a good job. If there's an issue that's realized in the home, that we can provide education to the parents, connect them with their healthcare professionals, whether it's women's health, their pediatrician, lactation consultant. So we really want to be out there providing a support to the parents and assuring that that baby's being cared for well in the home.
Yeah, I will tell you, I called my pediatrician probably 6 times a day, every day during maternity leave, because you do second guess a lot of things, or you think, was that cough normal? Is that supposed to be something that, I'm worried about? And I feel like having just that kind of peace of mind of a home visit can do a lot in that situation.
Absolutely.
Okay, Rob, you have 2 new programs, or we talk about these 2 new programs. How are patients receiving these? Do they seem to be, loving the fact that this is available to them?
I think it's clearly being well received by the patients, but I think their caregivers and support system as well. And I think at this time of the year, when we're probably going to see a lot of families reconnecting and get-togethers, and maybe you're going to see a mom or a dad who's getting to a point where they might be able to benefit, not from necessarily the traditional home care services, but maybe some of these new types of programs. It might be an opportunity to discuss some of these types of issues, and maybe see if your local hospital has some of these available to assist them throughout the year. And absolutely, I would guess that we will continue to roll out new types of services and cater to different diagnoses going forward.
Yeah, definitely. Always looking for that. Of course, that's Licking Memorial Health Systems. Thank you both so much for sharing with us.
Thank you for having us.